Vitamin D is one of the most harmful vitamins if taken incorrectly. I'm Dr. Vasyl Chaika, and in this video we'll discuss what health problems vitamin D can cause, why these problems occur, and who should absolutely avoid taking vitamin D. Every day you hear that vitamin D is very beneficial for the body, that it helps our nervous system, that it helps regulate our circadian rhythms, that it supports our endocrine system, our skeletal system, our gastrointestinal tract, our kidneys, and our liver. In other words, it's considered a universal, the best vitamin, and some scientists even say that it's not a vitamin at all, but actually a hormone. Thanks to it, if we have enough of it, we won't experience stress, we won't have inflammation, and so on. Let's figure this out together. How is this vitamin D produced in our body? Our body gets vitamin D in two ways. So the first way, our body synthesizes vitamin D on its own under the influence of ultraviolet radiation. How does this happen? The sun shines, ultraviolet light, specifically type B, hits our skin, and under the influence of a substance called 7-dehydrocholesterol, and just so you know, that's actually cholesterol. Vitamin D begins to form in our body. Then this vitamin D is transported directly to the liver, where it exists in an inactive form. Next, this vitamin D is transported from the liver through the bloodstream to the kidneys, where it is converted into its active form, and from there it goes on to our organs and systems. This is the first pathway, so please remember that if you constantly lower your cholesterol, or if your cholesterol is low, vitamin D will not be naturally produced in your body. The second very important point is that vitamin D also comes from external sources through food. It also passes through the intestines, enters the liver in an inactive form, then follows the same pathway to the kidneys, gets activated, and from there is used to meet the needs of our body. And of course, under normal natural conditions, there is a standard level of vitamin D for our body. It is measured in so-called international units. We need to get 600 to 800 international units per day for our body to function properly, both through sunlight and directly from food. And of course, we are told that all of us have a vitamin D deficiency. In particular, these are people who work in offices because they don't get sunlight, those who have poor diets, and since we are constantly under stress, we have a constant vitamin D deficiency. So how can we detect it? And every doctor has their own theory about how to detect this vitamin D. A deficiency, or rather, if someone has muscle pain, if you press on the sternum and it hurts, if someone has memory loss or some kind of erectile dysfunction, in other words, if there is any change in the body, they say that vitamin D deficiency is to blame for everything. They do tests, a blood analysis, and there they find the inactive form of vitamin D and say that you have a deficiency. Let's figure out together what the normal level of vitamin D in the blood is considered in medicine. So the normal amount in blood serum is considered to be 50 with a maximum of 100 nanograms per milliliter. In this case, vitamin D. If we have less than 50, down to 30, that's considered a reduced level of vitamin D. And if it's less, around 30 to 20, then in this case it's already a pronounced deficiency. And as soon as this is discovered, the doctor immediately starts sounding the alarm, saying that your thyroid will be disrupted, you'll have reproductive issues, you'll get cancer, this could be the cause of Alzheimer's disease, and the person is in shock, because up until now, nothing had bothered them. Or for example, there's another case when a person has chronic muscle pain, digestive issues, and they get their vitamin D tested. And the doctor says, look, all these problems are because you lack vitamin D, you urgently need to start taking it. And of course, there are certain prescriptions here, and our recommendations differ. And so, for preventive doses, it's said that adults should take from 800 to 2,000 international units per day for 2 months. Some say 3 months. If we are talking about a therapeutic dose, then it's at least 5,000 or better yet 10,000, again for 3 months, then take a 3-month break, get tested, and start taking it again. And so on continuously until vitamin D reaches normal levels. But for some reason, no one wants to mention a very simple thing about the negative impact that taking vitamin D in the form of these synthetic supplements has on the body. The negative effect of vitamin D lies in the fact that firstly, it activates the sympathetic part of the nervous system too much. What does this lead to? Firstly, this leads to a disruption of circadian rhythms, and the processes of falling asleep and wakefulness are disturbed. But we've been told, wait, when you have poor sleep, you should actually take a lot of vitamin D. That's the mistake. Let me tell you, as a pediatrician, in my practice at university, they told me, thank you. In various courses that all children should be given vitamin D. And so when I prescribe vitamin D to children, I noticed a very simple thing. The children slept poorly. When I started to question why, well, there could be different reasons, maybe something with the family and so on. But when vitamin D was discontinued, the children slept well. And you can easily check this yourself. The instructions state that vitamin D, on the contrary, stimulates the nervous system, so it is not recommended to give vitamin D to children, especially those who sleep poorly. Vitamin D also stimulates intestinal peristalsis. This can lead to diarrhea. Vitamin D leads to excessive retention of calcium in the body, and then we develop kidney stones or gallstones. So what's the big deal? I'm just taking vitamin D because my test results showed it's low. Yes, but you're actually harming yourself. But doctors say that hypervitaminosis can only occur if I take 50 a day. And some say 100,000 international units. Well, those are just theories every time. Of course, they'll tell you there are clinical studies. But the essence of these clinical studies is the same. You have to take it continuously over time. Because they explain to us that if we have a deficiency of something, it doesn't matter why it happened. You have to constantly take something. That's where the mistake is, because our body itself knows how much vitamin we need and where. We just need to normalize some very simple things in our lives. We'll talk about them later. What else can an excess of vitamin D lead to? First, it further destroys the stability of atherosclerotic plaques and they can break off. Vitamin D also impairs the process of memorization, even though we are constantly told that vitamin D actually helps prevent Alzheimer's disease. No. Vitamin D also leads to excessive muscle contractions, causing cramps and muscle pain. Additionally, dry skin can occur, as well as increased irritability, frequent urination, and a whole host of other problems. These affect the cardiovascular, nervous, endocrine, and other systems. But how can this be? After all, we're constantly being told to buy vitamin D and to take it synthetically all the time so that your wallet is always empty. By selling it under the guise of something very simple, that they care about your health. And who doesn't care about you? Because remember, your vitamin D is produced with the help of sunlight and enters your body through food. But how can that be? They tell us we don't go outside, we sit in offices, we eat unhealthy food. And this is often said, back then food was good, food was high quality, food was eco-friendly. So maybe the older generation has forgotten, thank you, how in the 50s, 60s and 70s they used a substance called DDT in gardens and fields. They used DDT to treat children for lice. You've forgotten about that. So what kind of environmental benefits are you talking about? At least 3 generations have already lived like this. And it's important to note that there wasn't such a deficiency of vitamin D. Of course, you're also told that if you have a vitamin D deficiency, you'll all get osteoporosis, you'll get rickets, your bones will break. But here's a very interesting point. Rickets or osteoporosis does not depend on how much vitamin D and calcium you take. And here's a simple example for you. In countries, for example, where there is a huge food shortage, like in Africa, what happens there? Rickets also occurs. But for example, rickets does not occur among the Eskimos, where there is a lot of sun, but then people will say there's no ultraviolet. So it turns out to be some kind of paradox. There's little sun, the food isn't right, there must be some golden mean, so that we don't have side effects and so that we stay healthy. Let's move on to this point now. In order for a person to never have a deficiency, the first thing we need to consider is the physical aspect. We need to spend time outdoors. Even if it's a cloudy day, it doesn't matter. You need to go outside into the open air every day. And sunlight touches the skin of your face and your hands. And it's enough to just spend 15, 20 or 30 minutes outdoors just taking a walk. And you already get the necessary dose of vitamin D. Of course, there are always people who immediately say, no, what are you talking about? There's not enough sun. It doesn't penetrate through the clouds. That's your illusion. You can live in it if you want. But biology shows something completely different. Next point, it's the food you eat. And yes, there is a lot of vitamin D in foods. That's fish, that's eggs, that's meat. So, by eating a small amount of these foods daily, if you eat at least 1 egg a day, or a small piece of meat, or a small piece of fish, you won't have a vitamin D deficiency. It doesn't matter that it's winter now. It doesn't matter that, for example, you haven't taken some kind of supplement. But another very important aspect, besides the physical level, is the emotional level, the level of perception. So when you are constantly under stress, worrying about something, always getting nervous because something doesn't align with your values and beliefs, this will happen reflexively. Whether you want it or not, you have to admit that your vitamin D level will decrease. And you won't be able to fix it with any supplements, even if you take them your whole life. Why? Because it's a reflex reaction. That's why you need to take a simpler view of life. Remember, we are living in a madhouse, in a psychiatric hospital. And if you take all this too seriously, no matter what minerals or vitamins you take, what will you always have? A deficiency. That's why only a comprehensive approach, where we act on both the physical and emotional levels, will ensure your health. Who is strictly forbidden to take vitamin D? So first of all, these are people who have ischemic heart disease. Those who have vascular atherosclerosis, those who have liver dysfunction, for example, fatty hepatosis or cirrhosis, those who have kidney dysfunction, such as chronic glomerulonephritis or varying degrees of renal failure. Vitamin D is also prohibited for those who have skin diseases, for example, psoriasis. Even though we are constantly told that it helps, no, it's actually the opposite. Vitamin D will intensify the dryness of synthetic skin and increase itching, which will be misinterpreted. It is also prohibited for those who have a stomach ulcer or a duodenal ulcer. Also for those who have excessive nervous system excitation or who are currently under stress. Because remember, vitamin D increases the activation of the sympathetic nervous system. Some people, when they start taking vitamin D, feel some relief, especially when, for example, there is an inflammatory process. Why does this happen? It's probably because vitamin D helps. You have to remember, vitamin D activates the sympathetic part of the nervous system and it blocks the healing of our body, which takes place under the guidance and control of the parasympathetic nervous system. For example, any wound heals because of inflammation. And any doctor who studied at a medical university will tell you this if they studied properly. But if you take vitamin D, inflammation is blocked and the wound, wherever it is, cannot heal physiologically and properly. And now it turns out that with the help of this vitamin D, you are blocking your body. You are not allowing it to properly complete the recovery process. This is where the mistake of medicine lies. So this temporary effect that you get does not make you healthy. It prolongs your healing process. Therefore, with just light nutrition and a calm lifestyle, you can live without any deficiency of any vitamins. Now I ask you to share your experience in the comments. What dose of vitamin D do you take? For how long? For what purpose? And what effects have you experienced?